Hi everyone, and AMC Connects here. I'm AnneMarie Czyz, President and CEO of Rome Health. I haven't introduced my full name and title in a little while. Just as a reminder, if this is the first time you've heard or tuned into an AMC Connects, this is a communication channel for the community of Rome, both inside Rome Health, and certainly we have launched widespread out to the wider audience and social media platforms and out there. And so a number of people have continued to tune in. I had shared on a past episode, I was just really filled up that members of the community, when I was at a community event, came right up to me and said that they had been listening regularly. So thank you. I do hope the topics that we're reviewing at AMC Connects really makes sure all of us are together. As you enter into the city of Rome, you do see that sign that says, "Together we serve." And we've really embarked upon that in a very serious way in our community, and very proud of that. On this week's episodes, we do have a few announcements. We have a great guest in a very essential services as part of our health network, and very excited to be able to touch on some kind of up-to-date notes regarding the podcast. So I hope you stay with me, everyone. Welcome back. I really hope everybody enjoyed last episode with Lauren Kinney, our acute nursing leader who just did a great job deep diving what's going on in acute care services, particularly the specialty of med-surg and progressive care nursing. That has been a specialty longstanding, a backbone of hospital-based care. And it's been a specialty that's been challenged, certainly since the days of the pandemic have really influenced and impacted that particular area. Of course, all of healthcare, but that particular specialty turned into a different type of unanticipated specialty. And it was really neat to be able to hear from her how that team is building into the future and keeps track of some of the great outcomes that we're striving here at Rome Health to accomplish our mission, vision, and values. Also, I hope everybody has had a great time during Nurses Week a couple weeks ago and Healthcare Week. We had great activities. A shout out again to the Wellness Committee and Sarah Nobis. Just awesome work and so appreciative. I have heard great feedback, and I was just out in a few departments across the network and people really trying to stay in tune and taking part in what those particular activities meant for them and their teams. So thanks to the committee. As always, give your feedback back, because I think Sarah highlighted one of her most special parts of Healthcare Week 2026 was she shared that she in the committee worked hard to kind of take in all the positive aspects of previous healthcare weeks and nurses weeks and attempted to emerge in 2026 as all the favorites came back. And so I thought that was a really neat approach, but any feedback is always welcomed so we can make sure that we are celebrating our profession, our industry, and each other as well as we possibly can. Well, we did celebrate a farewell of really, it kind of gripped me a little bit. Three employees, very, very special, with many, many years of service to Rome Health. So a shout out to Marianne Bouchard, one of our nurses, who's just served many, many years at Rome Health and retiring from Rome Health. We also had Cindy Soares, a respiratory therapist, who, again, many years of service. And I really appreciate when I touch base with Cindy because she always has a very connected piece of feedback from me when we connect in the hallways or on rounds or she stops in. And she's always shared the truth with a capital T, and that means so much. And I appreciate what she says as she demonstrates the profession of respiratory care. You know, we just make sure people breathe. We just want to let that land. Our respiratory care partners and their profession we're so thankful for them. They help our patients breathe in some of the most compromised situations. And then, of course, we heard in a previous podcast, if you didn't watch the Eileen Lully one, she did mention that she was retiring and moving on to the next season in life. And so hope you tuned into that. She shared some really neat things with us, and we celebrate her. So congratulations to those three from retiring from Rome Health. We'll pivot into the month-end message for April. We've been doing that and sending those written messages out, and your leaders within Rome Health have continued to talk about them in staff meetings and daily huddles. I am hearing connected feedback. I don't know that it's always great feedback, but really truthful feedback on how those month-end messages are helpful in making sure we're all up to date with what's going on with Rome Health. So this month, we wanted to focus on the strength of our quality and engagement pillar, specifically the meaningful progress on safer environments of care. Our work, I think I shared this on a previous episode, but our work in workplace safety is really delivering some measurable results. We've had nearly a 65% reduction in reported workplace injuries. Very pleased with that. Certainly humbled, definitely at times, because we still have workplace violence going on in terms of violence on healthcare workers that comes from the community on our teams. Several months ago, I had a conversation with one of our precious employees that did have a serious injury associated with a circumstance. Again, I think talked a little bit about that on an episode, but we've been doing some really important activities to help make sure that we're safer, and we're seeing some of those results. Prevention and detection, making sure that we are working our weapons detection systems well, and thank you to security and our patient reg staff who make sure that that access point is managed well and we get feedback. Environmental and operational controls, really making sure that we have that security presence on grounds to ensure that, particularly the main campus, to make sure that with all the activity, there's some frequent rounding going on and we can pick up some things. Partnerships and intelligence, making sure that we have continued collaboration and strong relationships with law enforcement in the area. We want to make sure that their time, which is extraordinarily valuable, is really well spent so that we're talking about specific cases that we can learn from, but even more importantly, that we can be proactive with as we work together. Accountability and learning. I'm very proud of our quality management team, that when events occur, particularly unanticipated ones, that we really do a deep dive, which are called root cause analysis. I think Scott Burns talked to us about that in the past, so that we can make sure that we get to the root cause of unanticipated situations that happen in terms of workplace violence, and we can correct our systems to prevent them from happening again. And then ongoing training, making sure that we recognize that society has changed and therefore our industry and our workplace has changed, and how can we make sure that we have up-to-date information, tools, and skills so that we can keep ourselves and each other safe. We did also want to make sure that one of my favorite things that I try to just highlight and keep in the back of my mind with all of us is when we're talking about being vigilant and accountable, make sure that we stay alert. We respect security protocols and our policies and procedures. We use available training, and we make sure all incidences are reporting. Now, on the incident reporting side, I have heard feedback from our employees that at times it feels like when I report an incident that I'm telling on someone. And that is very meaningful for me because we value our team and we value our relationships that we have amongst the workforce. But just remember that reporting an event, even if it's anonymous, gets taken so seriously that, again, it's not about individual people, it's about understanding our systems of work and processes that are supposed to keep ourselves safe. So keep reporting because it really matters and it's helped us immensely. While enhancing the patient experience through innovation, I've talked about, and we've talked about our virtual nursing program, but we have had a tremendous increase in patient engagement scores on the acute nursing side. We touched on this with Lauren in the previous episode, and it's really neat to be able to see that effective communication and how much our patients in the community crave that, need that, rightfully so, and virtual nursing has been a great tool that's helped us make sure that we can make those connections, and we're seeing that. So we're going to keep it up, and we're going to hear more about virtual nursing in the future. Did want to make sure transparently with our financial pillar that we are still in the April end or in March end, and some early signs in April, still seeing an operating loss, but we are performing a bit better than forecast. So we're very close to our budgeted targets for 2026. Congratulations and thank you to everyone. That's come with our very focused operating plan that we've talked about a few times, really making sure we're optimizing staff capacity. We're making sure those access points that we have, we're smoothing out operations so patients can see us and see us timely, that we're using all of our time effectively and efficiently. our expenses. We're really honing in on some of those services that we're having and negotiating contracts and expenses that are lower, and making sure that our rev cycle teams and that we're actually getting paid for the work that we do. So shout out to all of our teams working collectively to see some improvements and getting very close to budget. I did want to highlight a primary driver of our cash challenges lately, if you continue to hear that, is some of the expiration with an adjustment we had had on some of our Medicare discharge patients. That had been suspended for some time. Now, to correlate to the budget, we did budget for that adjustment. So for that to be taken away, unanticipated, had been really the gap that we're experiencing now. So again, always wanting to make sure when I know something, the workforce knows something, that suspension has been a challenge from our overall cash that's coming in the door for the payment of services. We have recently heard that that's going to be restored. We don't have an exact date, but really thankful for Nate Smith, our AVP of Finance, who's continued to reach out and make sure that we're tracking that well and that we know when that gets reinstated. This isn't a small feat, what we've been able to accomplish year to date. So great work, everybody, and please stay tuned and keep it up as your supervisors are continuing to work with you on daily work and behaviors that we need to have to make sure that we're doing everything that we can to support the care in our community and the work activity is working. So thank you. An announcement, wanted to make sure it has already been sent out, but again, sometimes the way we receive communications, hopefully people are taking some time off, or maybe the community may or may not see some announcements, but we wanted to share on AMC Connects, dear Rome Health colleagues, Rome Health has received approval from New York State Department of Health to relocate perinatal services from 155 West Dominic Street to Rome Health Pediatrics at 819 Black River Boulevard, effective Monday, May 18th. It was done. The relocation is designed to better align resources, strengthen collaboration among care teams, and continue to enhance care in families in the community. So similar to our operating model of that shrink to grow, this aligns with that as well. Many families who receive prenatal care through Rome Health also seek pediatric care after their baby is born. Locating these services closer together will support continuity of care for both mother and baby while allowing Rome Health to use space and resources more efficiently. The office at 819 Black River Boulevard offers additional parking and accessible through Centro's on-demand Move minibus service. The current clinic at 155 West Dominic Street is located in an aging building that will require significant repairs in the near future. This change is being made with a strong focus on maintaining a positive experience for our patients. Our mission at Rome Health is to provide quality healthcare with compassion, and this move will help us to continue fulfilling that commitment. Our goal is to make the transition as smooth as possible for both patients and team members. I was just connecting recently with Kristen Hutchins, one of our leaders in our practices, and she was checking in on patients just to make sure that they understood and saw some of the announcements. So we'll continue that proactive push and connection to all of you, but please feel free as always to ask questions. Make sure you call into Rome Health if you have any confusion. Well, with that, as promised at the introduction, a really special part of our network of services here at Rome Health is our Community Recovery Center. And we are, we're very proud of the work that is done in that particular area. And I just wanted to highlight what's on our intranet, that our Community Recovery Center, where substance abuse ends and the path to healing begins. At Rome Health's Community Recovery Center, or CRC we fondly call it, we believe recovery is possible for everyone. Substance use, including alcohol, prescription medications, and illicit drugs, impacts more than 48.7 million people each year, along with their families and communities. Our center provides compassionate professional care to help individuals take back control of their lives and move forward with hope. Here with me to talk a little bit more about our Community Recovery Center and some of the needs in our community is Danielle Russell. Danielle, welcome.
Thank you.
We're so excited to have you on Connects.
Yes.
Yeah. So that introduction, what's kind of verbalized on our intranet, that is a nice summary, right, of just kind of our position statement on our recovery center. Can you share a little bit more about our our center and what we do and our team, and
Absolutely.
expand a little bit for us.
So just like the description says, an outpatient substance use disorder clinic, we do outpatient services as well as intensive outpatient services. So if somebody needs a little more than, traditional biweekly sessions and maybe a couple groups, they can come 2-3 days a week, spend several hours at the facility with us, doing groups and getting support. We offer medication-assisted services. We're able to offer some mental health services for individuals who are admitted with a primary substance use disorder. A barrier for us is that they do have to have that primary substance use disorder before we can assist with that part. Hopefully that will change soon as it sounds like something we have talked about since the beginning of time, but planning to integrate.
I am so glad that you said that right away in the intro, Danielle. Let's pause there, go a little bit deeper if we can, because there are some limitations. And I think sometimes the community or people in need or people who are trying to shepherd people suffering from these challenges, they don't know sometimes the limitations. So can we go a little bit deeper on that?
Sure, yeah. So integration is what we're initially going to be going after, right? Prepping our applications. Staffing has been the main barrier for us to move forward with that. But that will allow us, that will allow us to treat people whether mental health is the primary issue or substances are the primary issue. Even that's not enough. When we apply for integration, at the same time, we will have to apply for Article 31. And that will give us the ability to treat mental health solely. So an individual would not have to have a connected substance use disorder.
Okay.
So those two things will happen together. In order for them to happen, we have to have the right staff and the right capacity to service both lines. But we know in this community and most communities, mental health is a primary issue for so many people. Substances are typically co-occurring with that. Chicken or the egg, doesn't really matter. You typically see the two together. And so the barrier is that oftentimes people, maybe they're not struggling with substances now, or that's really not the big issue for them. It's the mental health symptoms that they're struggling with. And so then we find that we sometimes have to turn that away and work to refer into the community. And the limitation is across the county, our county, every county, the state, the nation, so it's difficult to make referrals for those individuals. So when we can take control of that and just be able to offer that service regardless of what's primary or whether both exist, that's going to be a huge turning point for us in our organization.
Thank you for championing that so clearly for so long, because sometimes we can get tired, right, of trying to make sure that we're championing what's needed most for our patients in our community. And you have stayed on this while still providing in the structure that we can do, Danielle. So thank you for that. And because, you're an expert in this, but, understanding the topic a little bit deeper, sometimes it's hard to understand what maybe mental health or behavioral health struggles people might be dealing with that might be from drug use or vice versa. Maybe somebody's struggling in that area of mental or behavioral conditions or changes that might be maybe medicating themselves through another channel.
Absolutely.
Do I have that summarized right?
1,000%.
Yeah. Yeah. How many, just to put you on the spot a little bit, do you think that we're turning people away with that dynamic frequently?
Yeah, I mean, so as I said, it's often connected. And typically when we're getting the referrals, whether it's from the hospital or the community or other agencies, people just walking in, there's some degree of substance use going on. if a person is using, that allows us to just assist right away, right? And then we assess for whether or not it's best for us in our limited capacity to then also attempt to service the mental health side of that.
Right.
Because typically referring people out, it takes a while. There's not a lot of providers. People are waiting months to get medication appointments. And we are so blessed to have a psychiatric nurse practitioner who works with us 5 days a week. It's almost unheard of, as I understand it, in other clinics and what have you. So, and he's so dedicated to our patients. But he could do more.
Sure.
If we didn't have to turn away, I would say the percentage of people, we probably receive between 8 and 10 calls a week for individuals who are describing what is mental health only that they need. And if there is no substance abuse connection, we
aren't able to take that on.
Just are not. So we spend a lot of time offering resources on the phone, trying to connect them with other agencies who could help them. But again, we get the feedback that it's going to be months for an appointment. Maybe they do get in, they go to a walk-in clinic, but it's months to see a provider. So
it's a challenge.
It's certainly a challenge.
I really appreciated that you clued us into one member of our team at CRC. Could you round that out for us a little bit? Can you talk to us a little bit about the team at CRC?
Yes.
Because they're just really cool people,
we have
to say the least.
Literally the best team. Seriously the best team. So we're small, and there's 12 in total. If everybody showed up on the same day, there'd be 12 of us. We have myself, a clinical supervisor. We have our office coordinator who I tell everybody she's really the boss. Like, she just runs the show. So she runs the front. We have a health coordinator, a per diem RN. We have 4 KSAC counselors, 1 mental health counselor, and a social worker who will be starting this upcoming Monday, actually.
Great.
Like, big win for us.
Yes.
We've been waiting. This is what's been holding up the integration, is securing 2 mental health positions. We have our psychiatric nurse practitioner, as I said, and then we have a fabulous peer who does certified recovery peer services.
Oh, excellent.
Yeah.
I mean, what a neat team, right? Everybody's got their specialty, and bringing all those specialties together within this umbrella is what creates such a great experience. I don't know if that's exactly the way to describe it. You can describe it better, but a team that helps, like our introduction said, really kind of lead to success in this particularly complicated specialty, right?
And we consistently get positive feedback about our staff. I mean, everybody comes from a similar mindset, and for me, that's what I love about our agency so much, is that we're just small enough that everybody knows everybody, right? The clients know all the counselors, all the staff, right? From the top down. It doesn't matter what day the person works, everybody knows everybody. And so we're just small enough that we can keep that connection at all times. And the staff are all on board with sort of this client-centered model of treatment where we just meet the person where they are. It kind of doesn't matter, you know? So, yeah, it's great to be able to provide that.
How do you do that, Danielle? In the sense, I mean, like, what a big question. I know that was a little bit too broad. I know. I just love this too.
Give us your secrets.
I'm so thankful. But when you say meet the client where they're at, how does the team establish where somebody is in their present space? Is there evidence-based tools in the literature that are used? The way that different levels of expertise within the team get connected, because I've heard that many, many times in the community, that it's a special part of us that we really do try to make sure that client-centered and that we're meeting people where they're at.
Yeah. You know, it really just starts with asking the client. That's it. It's appreciating that they're an expert in their own life, and that as badly as we want to have the answer, or we think we have the answer from previous experiences or other people, they know for the most part. So you build rapport, you establish trust, and once you've been able to do that, you have a platform where you can point things out and allow them to agree or disagree with those things, right? And that just opens a dialogue where you can see that this is just where the person is right now, you know, whether it's they want to moderate their use, they're not interested in abstinence, they are, but they can't figure out why they can't get there, and accepting. It's just accepting. Whatever they tell us, let their truth be their truth. And then we just work inside that with all of those techniques and interventions to the best of our ability.
It sounds like such a deep respect for people.
Yeah, it has to be, right? It really does. It has to be. I feel like you can't judge what is going on with a person. You can't minimize. You have to just appreciate their truth and then just work with that. Yeah.
I've also found that this team is pretty special in the realm of being able to have some strong resiliency themselves, as well as kind of deep gratitude. We'll talk about both those components, but I haven't talked to you about this in a long time as I'm sitting here with you. I'm feeling a little remiss, you know, because the center went through a really hard time with the tornado that touched down. And we all kind of piled up on that. But then there's this amazing group of people that's doing this unbelievable work that's so needed that went through quite a bit as well. And early on, I checked in a little bit with you, but I think I remember you following a client to make sure that they had gotten what they needed, or at least, I mean, there's such dedication first and foremost to the client. And then the team had gone through so much and then displaced. And can you just give us a brief summary on that and how the team is doing now in response to everything they've been through?
I mean, I think everybody appears to be doing well, right? They just in typical fashion, it happened. Obviously, the entire community went through a struggle with that, but we only shut down for one day. I say it all the time. I'm like, how is that even possible?
Heroic. I mean, really, I'm so glad you underscored that.
24 hours. One day. That was it. We did.
And when you and I went there, or I think it was Jen and I went there to make sure that as 2 RNs we could secure the medications, it was gone.
Everything. Just a disaster.
Everything was gone.
Yeah. Just a disaster. We, the team of staff, we spent one day debriefing, right? We really prioritized that day one, made sure that we talked about where everybody was at, what do people need, do we need EAP services involved, do we just need to be doing check-ins? And then from that point, I mean, we were loading stuff up in cars, trying to lock files to the best of our ability, the hospital coming over with the trucks for the filing cabinets just to get everything over. And that was every single staff member. There was not a single person that did not participate in getting us there. Then we spent the following day doing phone appointments with our clients so that they knew what had happened, trying to reach as many as we could. And the very next day, live appointments. Telehealth, because we had to wait on the Department of Health.
Of course, we have to make sure we say that. In person. Our partner there.
Yep, we did have to wait on that, and which was okay because we have the telehealth ability. So we were able to set the computers up, start sessions, run groups, and then I think it was 72 hours before we could have in-person appointments.
Yes, and I should say this, and we should. Thank you to the Department of Health, right? They were really working hard to pay because we were just determined. To make sure. Thank you for that. I hope I've said that before now.
That was a crazy time.
It was.
That was crazy.
And just very impressive. I mean, when I close an AMC Connects episode, I typically underscore it with our tagline, right? Like the best care out there here. When we talk about the best, that is the best. I can't, of all the things I've strived to do with teams in healthcare, that is an example of just the best I've ever heard or seen of in the midst of such a traumatic event. So thank you. Well, I think that probably lines up with something we have talked a couple times about, but you as a leader, a formal leader, really emerge on our employee engagement surveys is very, very high. You are always a top performer. The employees in and around you have really kind of rated you and them very high in terms of their work satisfaction. Can you share with us a little bit about how you serve them, how you lead, and why that's so consistently the results that Danielle Russell has?
I know. I don't know. I think if I had to guess, because I don't fully know. I think what it is I have history of wanting to control everything, right? That's just a personality trait of mine. You can vacuum, but you can't vacuum as good as I can. Like that type of everything.
I appreciate your honesty.
Sorry, and I learned 6 months into my role, I learned that one, if I tried to take control over everything, I was going to minimize everyone around me. So I knew that was not going to work. And then I also learned very quickly, was humbled very quickly, that there's just brilliance around me all the time. So why would I not attempt to foster that? So I really try to just give as much as I can to them in terms of them taking the lead, right? I really try to make sure that people feel like they own the agency like me. Because to rewind the tape just for a second, when I very first started with the hospital, 2015 was when I started. One of the things that we were supposed to follow as employees was act like an owner, right?
Yes.
And right from the very first time I heard somebody say that in orientation, I was like, oh my God, that makes sense. Like,
it sure does.
Yeah, if I just treat CRC like it's mine, then I'm going to run it like it's mine, right? And then I wouldn't make decisions that I wouldn't make in other capacities, so I wouldn't be careless. And that was the piece that I just kind of tried to hand over to everybody, right? Like, this is our agency under the organization. And so we have to take charge of making sure that we run it in a way that works for everybody. And it's so cool to watch people doubt themselves for things that you want to see them be a part of, and then watch them be a part of it and do it, and not just do it, but excel. And so that's just continued to drive it.
Awesome.
And I really just think that's it. And transparency too, right? I'm working on that one. I'm extremely transparent, but I'm working on the balance on how transparent one should be. Sometimes I still insert foot into mouth, not good. I said that a little early. I shouldn't have said that.
Well, you know, thank you, Danielle. We are going to stay with Danielle for a couple more questions. But if you are new to our new side of AMC Connects with special editions, we have another one for you. So we're going to take a quick break to share a little bit of the latest of the special edition. And we'll be right back with Danielle with a couple deeper questions. Hi everyone, it's another AMC Connects special edition. We heard some great feedback, Chuck and I, when we did a special edition with Earth Day cleanup, and this is a tremendously special event. We're here at the Utica Club Golf Course, and it's a beautiful evening to celebrate our service award dinners. This year we have a tremendous amount of experienced employees that we are highlighting and we are celebrating. A couple days ago, we celebrated those employees who have celebrated a 5-year milestone, a 10-year milestone, and a 15-year milestone. And here we're celebrating those employees who have been with the organization greater than 20 plus years. And it's just tremendous. You may even meet somebody who's celebrating 45 plus years. Come with me, everyone. Julie, why are you excited about either being here tonight, and why is it so important to have employees who have had dedicated years of service?
Yeah, I think this is such a beautiful and important event. We are here and we're able to not only celebrate our employees and their service, but just the knowledge and the care that they bring to our community and to their team. You know, we have some highly tenured people here, and they're able to really pour into, you know, people on their team who haven't been here as long, you know, whether they have experience in the industry or not. And so just the depth of knowledge and training and understanding and being able to share our vision and our mission with the next generation of leaders.
Jim, how did you do it? 45 years. Did it like fly by or was it too long?
It went by really quick, really quick. One day I woke up and it was 40 years, and next thing it was 45, and I had a wonderful time there.
Thanks, Jim. What is your most significant point of pride?
All the new construction that's happened around the hospital, all the new technology that's getting invested into the hospital, and all the amazing things that's been happening.
We're at another table, and Matt Sales is with us to celebrate, and he's going to tell us why he's so excited to be part of the Service Award dinners and what's going on at his table, because this looks like a fun crowd.
This is a great crowd. This is a great crowd. I mean, I'm very fortunate to be able to have two pharmacy staff here tonight celebrating. So I have Dawn Simo Hewitt here, one of our pharmacists, still on our active roster, celebrating her 25 years of service. And then we have David Lee, many of you know him as Chip, here, you know, in a per diem status, but here for 30 years. So like I said, very, very happy with my starting point here. But yeah, you know, being surrounded by folks who've been in the Rome community for as long as they have in Rome Health, a lot of ability for me to just continue to learn and then use that to apply myself in every way that I can.
Thank you for tuning in to an AMC Connects special edition. I hope you've enjoyed it. We have wonderful people at Rome Health creating an amazing experience and amazing moments every single minute of every single day, accomplishing our mission, vision, and values. Thank you to the award recipients tonight, and thank you to all of you, our Rome Health staff. We appreciate you. Welcome back, everyone. I'm here with Danielle Russell, and we're talking through a very amazing component and vital component of our overall health network and services to the community, which is our CRC, our Community Recovery Center. And Danielle has been taking us through a variety of topics, such as the services that we provide, the team, and her leadership style. I think, Danielle, when you were talking about act like an owner, I think that's on the shoulders of one of the great leaders of Rome Health, which is Darlene Burns. I think she introduced that because when I think so. Yeah. Because when I first got to Rome, I mean, Darlene is a board member, and she has been just a wonderful person for me to know is out there and lean into, and all those great things. But people told me when I was first at Rome, you got to act like an owner. Yeah. Darlene Burns said, act like an owner.
I love it.
I do too.
I love it. Yeah.
Because it means so much, because it means everything. It means anything that needs to be done any given day. Yeah. And what you were just sharing is this amazing team at CRC does that. Acts like, it doesn't matter what's happened, that there's ownership. And so you're talking a little bit about your leadership style, and you landed on transparency. Do you think, like, there's, in this day and age, with all the time you spent on some of the population that you care for or that you lead through, like, could we be too transparent? It's almost like it feels like you can't be too transparent these days. Right. What do you think about that?
I don't think you can be too transparent. I think that for me, I sometimes can be transparent a little too early.
Oh, sure.
Yeah.
Okay.
That's all.
Yeah.
Sometimes I get a little excited, and I might share too quick. So maybe before I have all the information, right?
Yeah.
And then, of course, that can lead to confusion and questions.
Sure.
But I'm also never afraid to say that I misspoke or overspoke, or
you corrected.
Always. Yeah.
That's actually a great skill set.
Yeah.
Especially for leaders.
Yep.
Because people don't necessarily do that. Well, tough question for you. That's one of my goals too, as a leader, and then certainly in this position, because our community really respects transparency. How do you think I'm doing with that as a CEO? Because you've been through something.
Beautiful. No, I literally,
Right?
it's my favorite thing about you, actually. And I think that it has probably fed into some of the more dramatic changes that we've seen with staff satisfaction. Because I think that there have been times where people didn't understand what was going on. And sometimes even, actually, maybe I'll say all the time, even the worst response or the worst answer is okay if you understand it, right? Like at least where it's coming from.
Yes.
It's easier to accept, it's easier to embrace. So, and I've always been transparent, but that was the first thing I noticed about you, and my favorite thing, it still is my favorite thing about you, is that you provide that. So there's always information. One thing that people cannot say, maybe people might say that they still feel like they don't know enough. Nobody said that to me.
Sure.
But they can't say they don't know because the information is shared, right? So at least there's a platform for that.
Oh, that's great feedback. And then probably last question, Danielle, what would you pass along to our workforce and our maybe community on how to stay maybe centered and well, or maybe how to understand ourselves that well, and maybe if we do need help in different ways, how do we recognize that? It's a big questions, but I know that you got it. Like, what any advice that you pass along to us as people?
Just, provide yourself grace. That's what. I just think that there is so much pressure all the time on all of us in so many capacities. And I feel like often the pressure doesn't stop, right? There's work pressure, there's home pressure, there's financial pressure, there's world pressure, there's just pressure everywhere. And I just don't know that we always provide ourselves enough grace. So, and if that's not enough and you're still not feeling your best self, then just reaching out, talk to people. More people can relate to you than you think. People are similarly going through things. And if we don't say it, how would they know? How would we know, right? So just sharing it, talking it out, getting it off your chest, asking for help. If somebody doesn't help you, ask the next person for help. Sometimes that can be a stopping point.
Thank you, Danielle. Thank you for being on Connects. So proud of the work that you do in our CRC department. And again, probably should have revisited some of those challenges right from that resetting our clinic. Great work. As promised, everyone, and we haven't heard from Chuck this episode because we've just jumped in and kept moving.
I'm hiding.
But Chuck is with us. And I did have a community member say to me, you referenced Chuck, AnneMarie. You referenced this Chuck. Chuck is, again, to know him is to love him. He is the man behind and into and at times just really enhancing the podcast experience.
I push the buttons.
So he says he just pushed the buttons, but he has an art and a science to it. Well, Chuck, you would be very glad to know that I had an exciting moment after a couple episodes ago when I got asked, well, AnneMarie, what's your favorite toy as an adult? Yes. And you might see a new prop that I put, because it's positioned kind of odd. Danielle did such a good job. She didn't even ask. Like, what is going on here with your couch? But we have a prize for Danielle, of course, because she's been a great participant. But I had shared that there's a certain, I was given, it was dropped off in my office, a certain, I do like stress balls or stress releases, particularly throughout the day. And I said that on an episode, and sure enough, what ended up in my office, Chuck?
It's amazing.
Like, yes. And I was so excited because there was a little special note. I love our employees. I'm so grateful for all of you. Just a quick note. You're amazing. And Darlene, our wound leader and specialist, she dropped this off in my office. So why I was a little cryptic was, and wanting to highlight,
Flip that up a little bit. Let's see that.
Oh, skin.
Whoa, what's going on there?
But the way I had shared on that episode, it just positions perfectly, at least in my hand, for a stress ball. Darlene then shared with me when we ended up seeing each other during Nurses Week celebrations. She's like, did you get it, AnneMarie? Because I hadn't had a chance. And she had dropped off another one, which is a beautiful foot. Now, listen, we talked a little bit about the skin is very important. Skin health, especially for compromised patients, and we need to pay attention to things. So I don't want to give too much levity to it. So these were promotions, of course, to make sure that it stays up front in our minds to any pressure points can be danger zones in terms of skin that can break down. So we want to make sure there's awareness. And so Darlene was saying to me, AnneMarie, do you think that was really appropriate? I'm like, well, I thought it was unbelievably appropriate. Come to find out, everybody,
great.
it's not just me, Chuck, but two things to be very, very thankful for. One, I get a new one because mine's breaking apart because it's been many years. So thank you, Darlene. But I'm so grateful, Chuck. She was watching these shows. She was on Connects. Our visits to AMC Connects is going up, and there might be changes in the future.
We're getting a lot of comments on the new way we're shooting too. So everybody's really loving this type of wide setup that we got going on right now. So yeah.
I
Thank
don't
you,
love
everyone.
looking at it, but
I know this will look this way, but you get to choose, Danielle, which sticker that you would like for being on the episode. So feel free.
not your stress ball though.
No,
That's
I'm
hers.
sorry.
Booty stress ball.
I have that. That's just hold a placeholder.
I love this one. I'm going to take this one.
Thank you, Danielle. And thanks to Danielle again for being on an AMC Connects and going deep with us.
Yeah.
We also had something pretty exciting, but Danielle touched on it. We didn't even talk beforehand because just so confident to have this organic conversation, again, to keep promoting transparency when we connect with people and their natural selves here on AMC Connects. But we had a mailbag question, Chuck. I'm very excited about this mailbag. One, it's a critically important topic, but it's going to be the first mailbag question that's going to end up being an episode. We'll talk just a bit about that.
Yeah.
But the question is, bit of a teaser, people, what do we expect to happen with the cost of living crisis in regards to employees and patients? That at what point will we be more profitable to not go to work due to the cost of gas? So like Danielle said, there's pressure and stressors everywhere. So this was this question from a great person. How will Rome Health navigate this for patients and staff that commute long ways to get to work? We do have a number of the workforce that do. The cost of a global war affects everyone emotionally and financially, and it feels like it is coming to a head. I would be curious to hear your input on this. Just a great question, right, Chuck?
Yeah.
Really, really thankful.
Thank you for reaching out.
Yes, thank you. And it really, Tiffany didn't say that we couldn't share her. So Tiffany is a specialist, and she works in our, it's just escaping me. I think she is a referral specialist within our center. So grateful for her, and very important question. A couple thoughts off the bat, Tiffany. Your question does reflect, as even Danielle anchored on with one of her statements, a lot of feelings right now and sentiments in reality. The cost of living, especially fuel, groceries, utilities, creates real stress on ourselves, our families, and it can certainly be overwhelming. That's one of the reasons why our Health and Wellness Committee has been offering programs focused on financial wellness, including budgeting, debt management, and financial planning. These sessions are designed to help people better understand spending patterns and identify opportunities to reduce stress and regain a sense of control where we can have it. As Danielle was saying, some things we just don't have control, and sometimes then it's hard to find the places that you do have control. So Sarah Novus had talked a little bit about this, but the Health and Wellness Committee has been working hard on getting us some resources. We know that financial pressure affects our emotional well-being too. Again, that stress, anxiety, sleep, or maybe even overall health, especially for those individuals if don't know the skills that Danielle was sharing with us that can release that stress somehow on an avenue and internalize it. There can be real physical, emotional, and mental health stressors. Just to highlight, hospitals are facing many of the same inflationary pressures and families are experiencing. So the cost of supplies, medications, labor, utilities, and equipment has increased significantly over the past several years. There's likely not a couple days or week even that goes by where those stakeholders that have really been great partners in helping us run this health system come to us with increases in their financial needs as well. Just a really challenging time. And although we can't control some of those events, we really do want to make sure that as we continue to stabilize, remember, Rome Health is a nonprofit institution, and so we're working hard to gain that financial stability so that we can bring our resources and capacity right back into the institution in multiple forms. But I'm very excited, Tiffany, to share with you and others that we will, on next episode, have some experts here to go over some of those details. So thank you for the question. Thank you, everybody, for tuning into AMC Connects. And most importantly for this episode, thanks again, Danielle, and certainly our CRC. They are a tremendous, amazing group of people that are meeting needs that are just absolutely critical for all of us in this community. So thank you for providing the best care out there here